all of you to the 5th Annual Scientific Symposium of the ARISE Network. We are truly honored and thrilled to come together again in this auspicious scientific event that underscores the ongoing collaboration between the Africa Academy for Public Health and our partners in Tanzania and outside within the sub-Saharan Africa and beyond. The Africa Academy for Public Health was established in 2009. It is a Tanzanian non-profit, non-governmental institution.
Ladies and gentlemen, today as we gather here, this symposium serves as a platform for sharing and learning best practices among health stakeholders on addressing adolescent health and nutrition needs in sub-Saharan Africa. It has been a priority of the 6th phase government of the United Republic of Tanzania under the leadership of Her Excellency Dr. Samia Suluhu Hassan, the President of the United Republic of Tanzania, to improve health and well-being of adolescents, recognizing that they are the future generation of Tanzania.
Honorable Mwalimu, again Minister of Health and Member of Parliament, we honor you and we celebrate you for your steadfast dedication to advancing the health sector in Tanzania and your remarkable cooperation and support of our organization. As we aspire to do and promote more public health in our country. Asante sana.
And no two nations in a close bilateral relationship can solve healthcare issues that affect the globe. We must collaborate globally. We must have a multilateral approach. We must bring in people from all corners of the globe, from all sectors of our population, academicians, government leaders, civil society, physicians, all of us working together can reach the goal of making the world a healthier and safer place.
I also thank Dr. Mary and the team at the AAPH for organizing this and the opportunity for me to speak here. I'm very grateful, and I want to emphasize this. A gratitude to Professor Wofai for what he did 10 years ago, and the team that's been working with him to make sure that the African research implementation science. We talk about economic development, but those who will do it are the ones we are missing. The number of the impact is there of obesity by itself.
And share expertise on matters pertaining to transforming adolescent health and nutrition research into actionable practice and policy in sub-Saharan Africa. Looking at the symposium agenda today, I'm excited to see the presentations and panels that I'm confident will stimulate deep discussions around how to best transform adolescent health research into policy imperatives across sub-Saharan African countries.
Adolescents typically 10 to 19 years of age. Sometimes we talk about adolescents and young people, 10 to 24. Are sort of large numbers in many settings. 9 out of 10 adolescents live in low and middle income countries, particularly in Africa. Africa is a young continent. About 70% of the population in Africa are under the age of 30.
My name is Mahesh Swaminathan. I'm the country director for CDC in Tanzania. And just very quickly in terms of the outline, I'll give you a quick overview of what the PEPFAR, the President's Emergency Plan for AIDS Relief, as well as CDC's history in Tanzania. We'll talk a little bit about our programs and interventions to date. And I will focus a bit on our HIV program. Not that that's the only program that we support that benefits adolescents and young people, but I think it is the most illustrative, I think, of both our accomplishments as well as our challenges.
On behalf of UNFPA, the United Nations Sexual and Reproductive Health Agency, I am honored to be given the opportunity to provide remarks in this important 5th annual symposium of the ARISE Network under the theme Bridging the Gap, Transforming Adolescent Health and Nutrition Research into Actionable Practice and Policy in Sub-Saharan Africa.
On behalf of the Africa Academy for Public Health, Harvard University, and the Harvard T.H. Chan School of Public Health, I want to thank all of you today. I want to thank our speakers for being here, all of you for coming here today. I am honored to be a part of the AAPH team and very excited to be here today for the launch of the findings of the calcium supplement clinical trial. With the publication of these findings in the New England Journal of Medicine, we can be sure that this work will have a major impact on maternal health and neonatal health all over the world, here in Tanzania, across sub-Saharan Africa, but all over the world as well, especially in low and middle income countries and in India. This work is an excellent example of what happens when governments, funding agencies, universities, research institutes, academics, healthcare providers together to improve public health. As the ambassador said earlier, this is not something that any one party can do on its own. It shows the power of data, it shows the power of science, and I want to say it shows the commitment that we have at Harvard University and at AAPH to work with our partners here in Tanzania, across Africa, and in Europe to use knowledge to make a difference for the better in the world.